General Pathology for 4th semester medical students. General Pathology. General pathology is a branch of medicine that studies the fundamental mechanisms of disease, morphological changes in tissues, and the body's responses to disturbances. This field aims to understand the general processes of diseases before delving into specific diseases in particular organ systems. Below is a detailed explanation. Main components of general pathology. Etiology, causes of disease, primary causes, direct factors that trigger diseases, such as microorganisms, bacteria, viruses. Physical trauma or genetic mutations. Secondary causes, supporting or predisposing factors, such as lifestyle, environment, or immune status. Pathogenesis, the study of mechanisms or pathways of disease progression from its initiation to clinical manifestations. Example: how a viral infection damages cells and causes inflammation. Morphological changes. Macroscopic changes. Visible alterations, such as organ enlargement, hepatomegaly, or tissue discoloration. Microscopic changes. Cellular or tissue-level alterations observed under a microscope, such as degeneration, necrosis, or hypertrophy. Clinical manifestations, symptoms and signs resulting from disease processes, such as fever, pain, or skin lesions. Prognosis and resolution, understanding possible outcomes of diseases, including recovery, chronic progression, or complications. Basic processes in general pathology. 1. Cellular adaptation. Adaptation occurs when cells face environmental stress threatening their normal function. Hypertrophy. Increase in cell size due to increased workload. Examples: physiological, muscle enlargement from exercise. Pathological, cardiac hypertrophy, hypertrophic cardiomyopathy, due to chronic hypertension. Hyperplasia, increase in the number of cells in tissues capable of division. Examples: physiological, endometrial cell proliferation during the menstrual cycle. Pathological, benign prostatic hyperplasia, BPH. Atrophy, decrease in cell size or number, usually due to reduced function or supply. Examples: physiological, muscle atrophy in the elderly. Pathological, muscle atrophy due to immobilization after an injury. Metaplasia, transformation of one cell type into another more stress-resistant type. Example: respiratory epithelium in smokers changes from ciliated columnar epithelium to squamous epithelium. 2. Cellular injury. Cellular injury occurs when cells fail to adapt to stress. Reversible injury. Early signs of injury that can still be repaired. Examples: cellular swelling due to impaired sodium-potassium pump function, mild hypoxia. Fatty change in the liver caused by alcohol consumption. Irreversible injury. Permanent damage leading to cell death. Necrosis. Uncontrolled cell death causing inflammation. Example: coagulative necrosis in myocardial infarction. Apoptosis. Programmed cell death without inflammation. Example: elimination of cells with damaged DNA in cancer. 3. Inflammation. The body's response to injury or infection to eliminate causative agents and initiate healing. Acute inflammation. Rapid response, short duration, hours to days. Signs: heat, redness, swelling, pain, and functional impairment. Example: local inflammation from bacterial infection. Chronic inflammation. Prolonged response, associated with tissue destruction. Signs: fibrosis, tissue destruction, and infiltration of chronic inflammatory cells, macrophages, lymphocytes. Examples: tuberculosis, rheumatoid arthritis. 4. Circulatory disorders. Disturbances in blood flow affecting oxygen and nutrient supply to tissues. Edema, accumulation of fluid in interstitial spaces. Cause, hydrostatic pressure imbalance, e.g., heart failure. Thrombosis, formation of abnormal blood clots in vessels. Example: deep vein thrombosis, DVT. Embolism, obstruction of blood vessels by foreign substances, clot, fat, air. Example: pulmonary embolism caused by DVT. Infarction, tissue death due to obstruction of blood flow. Example: myocardial infarction during a heart attack. 5. Healing and regeneration. The process by which the body repairs damaged tissue. Regeneration, replacement of lost cells with new ones. Occurs in tissues capable of division, e.g., epithelium. Fibrosis, formation of connective tissue to replace damaged tissue. Example: scar formation in skin wounds. 6. Immunological disorders, imbalances in immune function. Allergy, overreaction to allergens, dust. Pollen. Example: allergic rhinitis. Autoimmunity, the immune system attacks the body's own tissues. Example: systemic lupus erythematosus, SLE. Immunodeficiency, weak immune response. Increasing infection risk. Example: HIV/AIDS. Applications of general pathology. Knowledge of general pathology serves as the foundation for disease diagnosis. Identifying tissue changes through biopsies. Therapeutic development. Understanding disease mechanisms to design effective treatments. Disease prevention. Using insights into etiology and pathogenesis to develop preventive strategies.